All right. So yeah, as Leah mentioned, my name is Norel Wheeler. I am one of many consultants at Family Caregiver Alliance. FCA, as we call it, we are an agency where we've been providing services to caregivers of adults with both physical and or cognitive impairments, like Parkinson's, stroke, Alzheimer's, and other, types of dementia for over 40 years. So I want to say about 47 years now. Our services include we do ongoing support through assessments. We also do care planning. We focus also on direct care skills, wellness programs, respite services, and legal and financial referrals. We do have an extensive history advocating for caregivers in the areas of, policy, health, social system development, research, and public awareness at the state, national, and even international level. So for today's presentation, I'm just going to be giving what we consider a broad overview on caregiving. We do have some classes coming up that go more in depth. If you do want a copy of the PowerPoint, please, email me. And if you want information on our upcoming classes, also email me. If you are a caregiver new to, looking at resources and services, and at the end, you do feel that Family Caregiver Alliance, we could, support you in your caregiving journey, please reach out to me and then I can follow up with you one-on-one. So just a quick general housekeeping, just want to make sure, I'm pretty sure we're all at this point very familiar with Zoom. One thing I like to say is that, if power goes out, just we'll help you get reconnected. Weather seems okay today in the Bay Area, so I don't think we have a problem there. Take your breaks as needed. I am going to be going through the slides without a break in between. I think everyone's muted. If you're not, please mute yourself just to limit our background noise, and just feel comfortable being here with us. And again, I will, sometimes I try to answer questions as they pop up, but mainly I'll save your questions to the end. And so please, again, like Leah said, submit them in the chat, and then we'll go from there. Okay. All right. So let's start. So who are our caregivers? For many, caregiving is just an expected part of life, and it gets passed down to us from generation to generation, and it's something that's just done without question. So it's important to identify yourself as a caregiver, or if you're a social worker here today, to help a family member identify themselves as a caregiver. Even if you or the person that you're supporting, slides into caring for someone naturally, right? Which was definitely my case, and I'm sure many of us here today. And the reason why I say this is because when we don't identify ourselves as caregivers, we might be missing out on, resources that are available to us that can help us, right? Quickly, sideway, I was what we consider a young caregiver. I started caregiving for my father who had dementia, and this was beginning of high school, let's say, and I never knew that I was a caregiver. And FCA was around when I was caregiving, and I wish I had known, because I would have used my own job's resources, and that would have made a difference. So our caregivers, as you see on the slide, we are unpaid individuals aiding family members and friends. We can be our spouse, we can be partners, adult children, parents, or even other relatives like siblings, aunts and uncles, nieces and nephews, in-laws, grandchildren, our friends, as well as our neighbors. We are those who do a broad range of tasks within our caregiving roles. So grocery shopping, helping our loved one get dressed, undressed. We help with physical therapy at times, speech therapy, or performing various medical interventions, such as giving injections, feedings, using feeding tubes, wound treatments. We also speak with various healthcare providers and arrange services. Caregivers handle legal matters, and we are simply companions. So I'm going to talk a little bit about the stress that we as caregivers experience. We know that prolonged caregiving has negative effects on the emotional and the physical health of caregivers, even though it's generally undertaken willingly. We see chronic stress, which is chronic long-term stress. It can be harmful because it leaves no time for rest and to rejuvenate. It also causes health problems and burnout. Burnout is a result of the physical and emotional exhaustion, right? So to name a few of the symptoms that you see here, it includes becoming like angry quickly or crying easily, overreacting to like minor nuances or inconveniences. losing interest in spending time with, your friends or other family members. It could be also physical, unintentionally gaining or losing weight, or the development of some new unhealthy coping mechanisms, as you see here. Additionally, aiding burnout is being in multiple roles. So maybe you work full or part time, or you're raising children, you're volunteering, or just have other additional commitments. These can also, all increase our stress as caregivers. So let's talk about the impact of caregiving on our health. We know that stress has a direct impact, right? So for one, there's higher rates of mental health, problems that arise from the caregiving stress. Family caregivers, we know, experience higher rates of depression, stress, and other mental health problems. Between 40 to 70% of caregivers experience symptoms of clinical depression. When it comes to elderly spousal caregivers, we know that they may have a 63 to 65% higher risk of dying compared to, non-caregiver counterparts. 17 to 35% of caregivers report their health as fair to poor. So this is particularly true for elderly spousal caregivers who are themselves experiencing mental or emotional strain. For them, there's about a 63% higher risk of dying than non-caregivers. For caregivers, we also have a higher rate of a diminished immune response, meaning, which leads to frequent infections and increased risk of cancers. For example, caregivers have a 23% higher level of stress hormones and around 15% lower level of antibody responses. Caregivers also suffer from slower wound healing, and we also have higher rate of visits to the ER. With a diminished immune response, we know that caring for persons, particularly for persons with dementia, it's reported to impact a person's immune system for up to 3 years after their caregiving experience ends. Those stress hormones basically are having a lasting impact on also like our organs, like, the heart, which can lead to, additional health problems. We see lower levels of self-care. Caregivers report not having enough time or energy to go to their doctors, prepare healthy meals, take medications on time, or fill prescriptions, and even exercise. Then there's lower income. So this leads to more stress. Older caregivers, people who make less money, and those with limited support networks report poor psychological and physical health in caregivers who are, say, younger and make more money and also have better support networks. But I also like to share there are some positive aspects of caregiving. So some of the most noted positive aspects are that it can bring a higher level of compassion, empathy, and appreciation, and thus improve the relationship with the person, that someone is caring for. The other positive is that you gain a wider skill set. So training on tasks helps caregivers, really feel like they're gaining new skills and making a difference. There's this sense of making an important contribution, which means, you feel like you're adding meaning to a person's life or maybe to your own life as a caregiver, it goes both ways. And then preventing institutionalization. So the care people receive at home undoubtedly, keeps them from being placed in a facility prematurely or even at all. And it can also allow people to live their final years at home. And, there's some cultural perspectives there that go along with that. So let's talk about some of the common caregiver stressors. This list, I have to say, unfortunately, isn't exhaustive, but these are the common caregiver stressors we hear reported or we hear caregivers talking about. The first one is money, and that's why, it says money, 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 because that's usually the biggest one, the cost of caregiving. So many people think that Medicare takes care of things. Many people think Medicare or Medi-Cal takes care of things like IHSS or that health insurance covers in-home care, like long-term care insurance. One thing that we stress at FCA is the ability and encouraging caregivers to make sure that we get our financial matters in order. So bring up the legal financial, important papers to have. Power of attorneys, those advanced healthcare directives. And, don't wait till, it's, I don't want to say too late, but, don't wait till there's a crisis to start doing that long-term care planning. And that is something that FCA, we support caregivers around, is understanding what those documents are. And then we have some referral sources. So I'll just throw that out there. We also know that home care is expensive and supportive housing is also expensive. Another common stressor is resistance or having, the person you're caring for, be what we call like the angry care receiver. Often they're struggling, with, over independence and independency, right? Driving and managing money, managing their medications. Maybe, families making a tough decision about taking away the driving rights. I recently had to, and it was sad, but my father had eye surgery and he's his history is he's on dialysis 3 days a week, can't see very well anymore. And we had corrective eye surgery, but it wasn't that successful. And so my father wanted to participate in the Super Bowl pool and told me that about 3:34 in the morning, he decided to get in his car to drive to the bank. Big mistake. Come to find out that he ran up on the curb and I just, talked to my mom. I was like, well, we have to take his car keys. There's just no doubt he can't, could have hurt himself and or somebody else. So a lot of emotions came up from that. But when it comes to, safety, we have to make those decisions. And it is a huge stressor to know that, your family member could be driving and harm themselves or somebody else, for example. And to piggyback that, children, we want our parents to be safe and healthy, right? Older adults are willing to take risks to stay in their home and to take care of themselves. So that puts, some stress on us as caregivers. Then there are family disagreements. This is often because other family members need either more information or they need more education, and they just need to know, quote unquote, how bad it is for the person that you're taking care of. Care supervision. We know that memory loss and cognitive impairment, they create a lot of additional, just needs. And then, of course, stressors around health and safety. Again, driving or, someone, a loved one who refuses to take, their medical or receive medical treatment. Um, Difficult with caregivers' feelings, so there's the frustration, the anger, the depression, and of course, the guilt. And trust me, I felt really guilty by making this decision for my father, who I respect highly. So let's talk about guilt because that's huge and it comes up quite often for us. So guilt is basically the feeling we have when we do something wrong. Guilt is for, maybe not preventing the illness, or maybe we feel guilt for getting impatient as caregivers, or for feeling like, you aren't doing enough or a good enough job as a caregiver. Maybe you feel guilty or there's guilt for thinking about your own needs and starting to think about them as, like you're being selfish. There's the whole concept around a lots of like I should and I shouldn't. So for example, which plays into your guilt, right? So there's, no one will do as good as a job as I do, or something might happen when I'm away. So I should be here all the time. That I raise my hand because that's me. Or it's my family members, so I should provide all the care. Yep, that's me too. Or there's like I shouldn't go to the movies or go to a concert because my loved one can't enjoy that same pleasure. So, what I like to tell caregivers, because I'm guilty of this too, but we have to remember that being perfect is a setup for failure. You and I, we all need permission to forgive, forgive yourself. You can't be perfect 24/7, and it's just impossible to be in perfect control of how you feel all the time, right? And then there's guilt versus regret. So, one thing we say is consider changing the guilt into regret because that kind of softens up this feeling of guilt. So, instead, we can say, I regret that I am human and get impatient sometimes. Or I'm doing the best I can, even though things go wrong from time to time, and I regret that I'm not perfect. So, one thing to support us is engaging with our family and our friends. Most people, again, naturally find it hard to ask for help, and about half of all caregivers do not get outside help. And show of hands if you'd like, but how many of us here have responded with something similar to, no, it's okay. We're doing just fine. When someone asks if there's anything they can do to help. I say accepting help early on in caregiving, it makes it so much easier down the road. And this means knowing your own needs. So know your own needs and ask, also let go of assumptions that others actually get it. People often don't get just how hard this is, and you can't expect them to. You need to tell them and ask for help. I tell my caregivers, people want to help. They just need to know how. They need to know like what you need help with. I tell caregivers it's as simple as making a list and then sending it out to everyone. And what works for one person may not work for someone else. In our household, for example, when it comes to my mom's health, my niece is not someone who's going to take out the trash, but she is someone who will go and get groceries from the grocery store. So she helps out that way. um, yeah. So again, having a list of things you need help with, maybe you can post it on a fridge or, do it with family and friends. You can do a group chat or group email. Google Docs work great and are simple that you share with everyone involved. And then again, just allow them to pick something that they would like to do. Okay. So, just understand that again, people want to help, especially if they've asked to help you, but they feel powerless when they don't know how to help. So there's also a couple of websites you hear that's under the use in this slide. There's a couple of what do I want to say, like applications out there. One is called Lots of Helping Hands. It's an app-based platform where you can coordinate help, where family and friends or those of you here today helping caregivers can volunteer for a task or communicate updates. It's also for caregivers to communicate needs for help and with what, and also I think you can still upload photos and leave positive messages for the care recipient. Caring Bridge is another one, another app platform for sharing health updates, photos, and videos with all those involved in the care of a loved one. So also I like to just say like little things on a regular basis can mean a lot to lower caregiver stress and those negative feelings or behaviors associated with caregiving. So we're going to talk a little bit about how to pay for help. I will say that if you want to know more about paying for help, you can always contact the State Health Insurance Assistance Program or call 1-800-MEDICARE. And so let's talk about what Medicare is. Medicare has different parts. There's A, B, and D. Medicare will pay for physical therapy prescribed by a doctor as long as it's deemed medically necessary to treat an illness. Medicare Part A includes hospital insurance, or Part B, which covers our outpatient treatment, may or not cover physical therapy, but it depends on the specific circumstances, the setting and the time frame. And this holds true also for like speech therapy and occupational therapy. Medicare used to set an annual maximum for what it would pay for outpatient therapeutic services, but that cap was eliminated in 2018. Medicare no longer limits what it will pay in a given year for a beneficiary or care recipient to receive medically necessary therapeutic services. With Medi-Cal, you can have up to $2,000 in assets as an individual or $3,000 as a couple. Assets that do not count include your primary home, a single vehicle, life insurance policies valued at $1,500, or prepaid burial plans or burial plots. And I think I'm going to share it with you, but I'll just jot it out there now. There's an organization called the California Advocates of Nursing Home Reform, or CANHR, CANHR. It's a resource with a list of attorneys who are, in the Medi-Cal field. I recommend all caregivers to go to that website for any eligibility questions you have about Medi-Cal, qualifying, understanding spousal impoverishment laws. You can call them. They're based out of Berkeley, but they cover the entire, Bay Area. When it comes to Medi-Cal too, in relations to what's called in-home support services or IHSS, Medi-Cal covers home health services that again are medically necessary, like skilled nursing care and medical equipment, for individuals who are needing like ongoing non-skilled care, like assistance with bathing, cooking, and chores. That's where the IHSS program comes into play. It pays for home care services that aren't necessarily medical in nature. So the types of services covered include house cleaning, right, for the person that is care receiver, meal preparation, doing their laundry, grocery shopping, bathing, bowel and bladder care, accompaniment to medical appointments, and protective supervisions for certain impairments. So to be eligible for IHSS, at the baseline, you have to be 65 years or older, or disabled or blind, and you have to be living in a home and not, in an institution or a skilled nursing facility per se. In addition, you must meet the financial eligibility criteria for Medi-Cal, and you must be unable to live at home safely without IHSS service as the care receiver. And when it comes to care, long-term care insurance, Medicare coverage for long-term care is costly and it's just very limited. And private long-term health care insurance generally won't cover nursing homes or assisted living facility and home care services. The insurance primarily pays for supervision or assistance with everyday tasks like bathing or dressing. When you have a physical impairment or need supervision of these activities, when you have, a cognitive impairment like Alzheimer's or other types of dementia. Long-term care also takes place at home or in a community program, in an assisted living facility, or in a nursing home. The long-term care services are often provided by family members or nurses' aides and do not require the skilled care that nurses and doctors are licensed to provide. For California residents needing long-term care services, Medi-Cal is the most common source of funding there because I think Medi-Cal pays for nursing home expenses up to approximately 65% of the residents that are in our California nursing homes. Lastly, here on how to pay for help, if you're a veteran, VA benefits. VA benefits are based on the specifics of an injury or illness that sets a disability rating, which then determines the disability compensation. VA service connected disability compensation, it's a tax-free monetary benefit for an injury or an illness that was incurred during active service or that one that resulted after service, but are secondary to disabilities occurring in service. Non-service connected is a needs-based program for veterans with wartime service who are permanently and totally disabled or over the age of 65. To receive a non-service connected disability pension, you must show a financial need. The VA considers you to have a financial need if you do not have income greater than what's called their maximum annual pension rate, which is set by law. Within the VA, there is a non-taxable stipend program for the primary family caregiver. It's called the VA's Patient Alignment Care Team, or PACT, which evaluates for eligibility through assessing like what's called the ADLs, IADLs, activities of daily living, instrumental activity of daily living evaluation of a veteran, and includes an evaluation of, supervision and protection needs based on their symptoms or impairments, / injury. And then based on the outcome of the evaluation, units of service are broken down into 3 tiers. The high or maximum tier, it's 40 hours of care per week. The medium tier is a maximum of 25 hours of care, and the lowest tier is a maximum of 10 hours of care per week, which reflects the actual stipend. And so overall, all of the person's injuries or illnesses are considered for pension benefits, not just the injuries or illnesses that occurred while they were on active duty. But again, this is not my area of expertise. So if you have more questions regarding VA benefits, please contact, your closest Department of Veterans Affairs. Okay. So we're going to talk about what we call the IRS of caregiving. And the first one is information. And what this is really about, and information, respite, and support, that's IRS. But when it comes to information, what we're talking about is getting information about the diagnosis, where to get financial legal support, and those community resources. So under diagnosis, it's really about understanding medications and medical interventions, so for example, understanding, what possible problems might, your loved one experience with a medication or the medicine they're taking, knowing how does it interact with other medications, with certain foods. And also, are there activities to avoid while taking, certain prescription medications? Will they make someone drowsy when they need to be, starting physical therapy, making those adjustments when you give them? Is there home delivery or, for medications? Is there medication counseling available? And, how can I prevent, these problems from occurring? Or at what point should I report problems with the medicine that's prescribed? There's also, information knowing a little bit more about like the skills that are needed to provide care. So what knowledge or skills will you or a caregiver need to be able to care for a loved one? Where can you get trained to do these tasks and that are required? And how can you learn it successfully, like, feed, bathe, handle, toileting, or incontinence? It's the list, goes on and on and on. And, should you understand, or is there a complicated medication schedule? What does that look like? Transferring, will you need help with transferring? Does your loved one need help with walking, and what will that look like? So just making sure again that you're well informed. Another area is the progression of disease and changes. So knowing and having information about how does the disease progress, what changes need to be made towards care in the future, what physical limitations does your loved one have now or will they have in the future? What are the cognitive changes you can expect? And for some, such as those living with dementias, what are the communication strategies one needs to develop or learn as the disease progresses? Then there's the financial and legal aspects. How much money is available for care, right? And who can access it? Are there debts or other constraints on using the money or funds a loved one has? What legal matters should you know about? Are there legal documents? Is there a will or trust? You know, um, does your loved one have a medical, and a financial POA or power of attorney? Does that need to be completed? What about release forms with medical providers? Are those in place, right? So a lot of questions to be asked and to make sure you have information as a caregiver and while you're caregiving. Then there's community resources. These are those resources that help, caregivers as well as, as well, and most can be found by contacting what's called your local area agency on aging, or AAA, or you can contact 211. That is also a link. Through the VA, there may be veteran benefits again, and also using what's called the Elder Care Locator. And then Family Caregiver Alliance, we have what's called our Family Care Navigator. If you're not connected again to FCA, more than welcome to, look our website up and look into the Navigator, because we have a host of resources there too. You want to make sure you have resources available around transportation, home delivered meals, day programs, legal help with benefits, and even like home repairs. Do you need home modifications for showers and all that stuff? So this is a big one. This is the R, respite, in-home respite. In-home respite can be done by, one, asking family members and friends. It's sometimes hard to do, right? But family consultants, we've seen all sorts of arrangements. We know that some caregivers do get paid to help. Some do it for free. And then there are all sorts of things that, can be helped with. Hiring in-home help where there's a fee for service. So depending on where you live, there are various home care agencies that can assist with non-medical or personal care respite. Maybe you have a doctor's appointment or you need to run errands for a few hours. A local adult day programs or some, residential facilities may offer temporary respite. Okay. And then there's also private hire. There are attendant registries through independent living centers and through online registries like CareLinks is one. Care.com is a familiar one. And in addition, you also have like faith-based communities, disease-specific organizations like the Alzheimer's Association is one I can think of. And through them, they have networking, which can help you find private hire. Okay. And then again, if you can't afford to pay for, it's expensive, right? And we're just all at different, financial, income brackets. But one way is to see if you qualify for Medi-Cal. So getting a loved one on IHSS. There also are some respite grants. The Alzheimer's Association again has one. I can give you their number real quick. It's 800-272-3900. I can also repeat that. It's up here on the slide. Family Caregiver Alliance, we have a respite service, if you're a client of ours. And then again, there's just disease-specific nonprofits and organizations that also offer their own short-term respite grants. When it comes to looking at out-of-home respite, short-term respite facilities, assisted living, board and care homes, or skilled nursing facilities. You would have to qualify for Medi-Cal to be eligible. So one organization to look at is called Seniorly, just www.seniorly.com. There's the information here for the CANR that I spoke to earlier, with their phone number. Um, and then again, the VA, it's inpatient, for inpatient respite, county specific, and adult day programs, of course, are county specific. There is one other program. It's called the PACE program that's found throughout California. Um, so there's over 273 PACE centers in 31 states. PACE program is free with no share of costs, Medi-Cal, if you have Medi-Cal. If you have a share cost, you will have to, you have to pay that, of course, first before you can participate in it. Let's talk about caregiving support. You cannot do this alone. Caregivers, we can't. It's impossible. And like respite, getting support for your caregiving situation will help you take better care of yourself. I tell caregivers this, the longer you are a caregiver, the more isolated you can become, which can lead to your own health problems. And I know too, it can feel like one more thing to do to take care of yourself, which is why many caregivers don't get the help they need, right? But a good place to start is to be with others who are providing care, who can relate to you and understand. Now, support groups can be invaluable in taking the first step towards taking care of yourself. However, sometimes people need to talk to an individual rather than a group. I'm one of those people. So, there are some options, and I've listed them here for us. So there's a 24-hour friendship line. Based on where you live, there are, community social service agencies. There's like a crisis support services. It's county specific, but there's on-site, there's Zoom counseling for adult caregivers, for young caregivers, for our LGBTQ plus community of caregivers. For caregivers who are spouses, the populations go on and on. And then through Family Caregiver Alliance, we also, again, if you're a client of ours, we have a counseling grant for individual counseling. We do also offer a support group with a wait list, but it's a phenomenal support group for young caregivers as well as, everyone else. Let's talk about legal issues, and we're almost done here, like 2 more slides. I mentioned this before, but really important to see what legal documents you have in place. If you have an estate, it's important to get, affairs in order. There are a couple of reasons for that. One is Medi-Cal, the other is probate. There's an organization called HICAP, number is here. But HICAP can help answer Medicare questions. The number in the slide is for us, for state of California. SALA is based out of Santa Clara, and they provide assistance with probate planning, simple wills, public benefits, etc. And they are also offering services at like the local senior center. SALA tends to go there too. There's free legal assistance programs, which can be found at the Legal Aid Association of California or contacting the California Office on Aging. Here's some information, additional resources, the VA Caregiver Support Line, California, again, California Advocates for Nursing Home Reform, CANR, again, advocacy, education, and legal assistance can be found there. And again, you can have these slides so you can, don't have to write this down. So I want to talk to you a little bit about what we do, and then I'll open up for Q&A. So we, FCA is also a resource, and as mentioned, we provide, information and referral services. We offer education, we support. We have Care Now, which is a personalized dashboard, and also host a lot of resources. We do our research and advocacy, and we just have a wealth of free online resources. We have more than 80 fact sheets. We have webinars, newsletters, support groups. You can find us on Facebook, et cetera, et cetera, et cetera. And so with that being said, that is the end of my presentation. I will stop sharing if I can. And I'm going to go into, let's see, we're at 3:40. I'm going to look at the Q&A. Okay. How can I share this with my siblings? Well, there's two ways. So myself and my colleagues, we do caregiving 101, excuse me, a couple of times throughout the year, Joanna. And so one way would be to, you know, sign up through CareNav, and then you can get or look for our newsletters, sign up for our newsletters. And then you'll also be able, and I'm sharing this with her, but everyone else, you'll get information on all the different classes that we offer and all the trainings and all the webinars. Okay. 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 Let's see. And from an anonymous attendee, thank you. They say, I believe Medi-Cal loosened asset-based eligibility restrictions. Um, they've provided us with the link. So I don't know if I can share this. Thank you for sharing that. Um,
Yeah, I wanted to pipe up to Norel because they, as of last January, they no longer look at assets for
okay.
Medi-Cal.
Thank you. Thank you for that.
And I think the income limit is a little higher than what's on your slide
That was on my
now.
slide. Okay. I will update that. I apologize, everyone. And no, IRS on this slide is not related to tax. It was related to, you know, the highlights of basically self-care and self-preservation, information, respite, and support. Okay. Yeah, so I think we recorded, the presentation is being recorded to answer the question. If you want the slides, by all means, I'm going to stick my email address in the chat. I think that's just easier.
Also, we can send, we send a follow-up email, so I can send the slides and a link to the recording to everyone.
Perfect. So I still put my info. And I think I answered all the Q&A questions. Okay, let me see, was there one more? Okay. Where do we go to get training on post-discharge care for stroke patients? Ooh. Post-discharge care for stroke patients. I would think that that would be something that you would coordinate with the actual doctor and the discharge planning team. So a case manager or social worker should make sure that you and your loved one go home with like a wraparound support, especially after a stroke, to learn again how to do, like speech therapy, occupational therapy, physical therapy. You should not be going home without that information and without those resources already as part of your discharge planning. Okay. 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 So someone says, hello, I'm a new caregiver. I appreciate all the resources and different things I can access, but find everything overwhelming. Are there any resources that you know of that are available for folks who are new to caregiving and living with ADHD? Well, we focus ours, and thank you for this question. We focus on adult onset neurodegenerative disorders. So, I mean, we do have, a caregiving, besides caregiving 101, we do have what's called powerful tools for caregivers. It's a 6 weeks training. It goes more in depth into talking about like, how to do like self-care and how to communicate well with someone that you're taking care of. So to the attendee who's asking about that, that may be something that you might want to, take part in. And like I said, have a look out through our newsletter or, on our website. And if you're new caregiver, okay. Yeah. And so if you're age 60 or older with a disability, or if you have an onset of what am I trying to say, you guys? If you have are living with a neurodegenerative disorder, that's where our target population is. Um, I'm not sure where additional resources that tie into ADHD are, but like, as far as caregiving in general, there's a lot of resources out there. So I'm sorry I can't offer more information and answer your question a little bit more beyond that. That's, the limit of my scope. Um, yeah, what is a good way to contact our agency? Email or telephone. So we do have lovely resource specialists who, if you call our general number and just say, your name and who you're caring for, leave your contact information, they can call you back and they'll do an initial intake and then direct you from there as far as next steps to talk to a consultant who will then do an assessment with you and look more into, your caregiving journey and experience and find out how we can better support you. All right, you're very welcome, Ms. Elliott. She says thank you so much, or he says thank you so much. Okay. And Jennifer Grant is saying that there is a citywide peer support group for caregivers. This third Thursdays, 1 to 2 p.m. on Teams. Okay. Thank you, Jeff. Neurodivergent caregiving would be a future webinar topic. I'd be interested. Okay. Well, I will thank you because sometimes I am looking at like new topics to discuss. So I have to remember to write that down. Um, any resources for lower dental plans for seniors? That I do not know because our capacity as consultants is different. We aren't social workers in that light. But I'm sure there are plenty of resources for lower dental plans for seniors. I mean, I know that there's part of Medicare, just depends on your insurance that you have for that. I know, who was it? San Francisco, was it UCSF? They, I think, have like, or they used to have a program that was more of like, to help eat up some of the costs because it's a school, they have their dental school there.
Yes.
So CSF is a resource that you could look at for dental plans for seniors. Okay. Okay. Oh, thank you. So thank you, Anonymous, who had a great time with us, and it just says that they're gonna recommend us and the presentation to their peers that are new caregivers. Okay. And someone from FCA come to give 30-minute presentation on specific topics. Jennifer, can you be more specific? Her question is about the group. Can someone from FCA come to give 30-minute presentation on specific topics? Can you elaborate a little bit for me? Are you still here? Okay. Okay. Well, I think I've gotten through all the Q&A questions. As you see, I am a normal person just like you guys are. Let's see. Oh, thank you, Leah. Okay. Well, oh, okay. How to deal with incontinence, wandering, etc. Let's see. And you're welcome, Renee. Thank you for being here. You're welcome, Joanna. I'm trying to think, which one do we have that deals with incontinence? So you might want to see, well, we have like Dementia 101, Jennifer. That is a good one. And I'm trying to think. Actually, I think I'm doing Dementia 101 tomorrow. I don't think it's too late for anyone to sign up for it. But that gives like an overview of like dementia and what it is and, some of that stuff. If you want to know a little bit more about how to deal with incontinence, I don't know, some of you may have heard of her, but Teepa Snow, her name is, let me type her name into the, she's wonderful. She has YouTube videos. So sometimes caregivers, and we have like information as well, like fact sheets and stuff that you have to read, and we have videos as well. we have like a caregiving college that you can find at FCA on YouTube. But between that and Tifa Snow, she, shows you models and gives you examples of how to, you know, address incontinence, address wandering, address, even like addressing someone who has Alzheimer's and doesn't want to shower anymore, and can talk to you more in depth about that. So I would first step like look at her videos and check her out and look at what we offer between the two. Um, yeah, and then there is like we have one. Gosh, I'm blanking out on you guys. It's called It Takes Two, Jennifer. So that is another, presentation that we offer where it talks a little bit more about, how to handle some of the ADLs, the IADLs of caregiving.
Um, would that be on the events and classes section of your website or?
Yes, exactly. Yeah. So
Okay.
and they happen throughout the year. So again, look for just keep your eye out. To be honest, like I'm not sure. I think we just had a It Takes Two um webinar not too long ago, but we offer them at multiple times throughout the year, every year. Okay. And then you guys are more than welcome to just like email me directly with some questions. And when more than happy to find a couple of fact sheets about incontinence, dealing with medications, the wandering, that I can share with you, or that you can also find them on our website. They're usually like 2 to 3 minute reads, sometimes more. I mean, like we talk about anything and everything you can think of related to caregiving. It's there. How to take care of yourself. How do you have conversations with siblings? When you consider placing placement, like how does that how do you handle the emotional side of that? Um, how to take care of yourself. I think we even have like we have a caregiving contract. Like how do make a contract with yourself? Legal issues, we talk about that. How do you how do you have difficult conversations, right, with family members? How do you hold a family meeting? You know, just anything and everything you can think of, we have there.
Thank you so much, Norel. That was wonderful.